This ministry has been in the forefront in the management of the crisis brought on by the pandemic. The parallel healthcare system has served this country well, and our citizens have been kept updated with the daily briefings by the minister and his management team. The vaccination drive now takes center stage as we emerge from lockdown and ease restrictions.
Hello, I am Terrence Deyalsingh, the Minister of Health of the Republic of Trinidad and Tobago. As we come to the close of 2021, firstly I will thank the Honorable Prime Minister for reappointing me as his Minister of Health. It has been a privilege to work with Dr. Keith Christopher Rowley for the past 6 years. The novel coronavirus has characterized the health response now for 2 years and will do so for the immediate future. As a novel virus, we had to come up with novel solutions to treat with this issue. Trinidad and Tobago's response was to create something called a parallel healthcare system of over 1,000 beds, manned by the most dedicated and professional healthcare workers that Trinidad and Tobago has seen, and for them, we owe a debt of gratitude. In treating with this issue, central to fighting this pandemic was always going to be communications and trust between the people and the government. Trust is important. Building that trust, we have hosted over 153 press conferences over the past 2 years. The Honorable Prime Minister himself has hosted close to 20, and we have issued 922 updates. This trust must continue as we move forward in 2022. Another crucial response, and you have seen this over the world where hospital systems become overwhelmed, was that the parallel healthcare system was not only a response which was agile and resilient to deal with COVID, but many persons don't recognize that our normal healthcare system, where hundreds of thousands of persons depend on for their daily health care, was largely untouched. The benefit of this to Trinidad and Tobago is our maternal mortality rates continue to be world standard. Our neonatal mortality rates, basic important services like oncology, dialysis, were also left unaffected. This is the beauty of having these two systems. The normal system basically left untouched as opposed to many other countries with more resources, and the parallel healthcare system. As we continue to battle this, we also have to be aware of current and future aftershocks that are going to hit us and that we have to recognize. Two current and immediate aftershocks are going to be mental health. Mental health and the aftershocks of this pandemic is going to be crucial. This government, even before the COVID-19 pandemic, took the brave and wise decision to decentralize mental health. What does that mean? It means that we take away some of the stigma associated with St. Anne's being the repository of everything to do with mental health. It means you can get mental health services in your community. But to deal specifically with the mental health issues of COVID and post-COVID, we have taken the bold decision to work with 30 agencies, 5 RHAs throughout Trinidad and Tobago, and 25 NGOs to launch something called Find Care TT, which is a one-stop shop to finding mental health resources. Everything from suicide hotlines to child abuse to TTPS to mental health care. That is an innovation that Trinidad and Tobago should be proud of. The other aftershock we will have to deal with is that of Ncds, non-communicable diseases. As you know, this has been near and dear to me for the past 6 years. We must bring the 3 highs to 3 lows. High diabetes rates, high sugar, high cholesterol, high hypertension rates, and we must treat with that. COVID-19 has placed challenges on us to do mass screenings. And you have seen the ravages of COVID-19 on those with diabetes, hypertension, obesity. We have to become healthier, live healthier, think healthier, drink more water, exercise more, and watch what we eat. And get back to the days where physical activity for all our children and adults was a key staple in everyday life. As we move forward, I want to thank everybody at the Ministry of Health. But it's not only about COVID. It's not only about mental health. It's not only about oncology and providing care for dialysis patients. As your minister, I can assure you that our infrastructure program was never derailed by COVID. The central block in Port of Spain, a 450-bed, 13-story tower, is underway. The new San Grande Hospital to serve that peninsula, that eastern part of the country up to Toco, Matlot, is underway. Our Ministry of Health head office is underway. We never let the pandemic stop us from building the linear accelerator at St. James, where we could expand our radiation care for cancer patients. All of these things we did and you did with our help during the past 2 years. As I close, don't let COVID-19 send you into fear. Let us be vigilant. Let us be our brother's keeper. Let us be careful this Christmas season. And please, let us vaccinate. Don't delay. Vaccinate today. May you have a wonderful Christmas, a bright and prosperous 2022.